Daisy from Quick Core Fitness. I am the creator of this channel, a physical therapist, a Pilates mat instructor, and a health coach. If you like this video, I would love it if you could hit the like button below and share it with your friends and family so the information can get out to more people. And better yet, subscribe to the channel so you won't miss another post or another video. Hi everyone, welcome back to my channel. Today I thought you should know the use of PRP in the surgical management of some common shoulder conditions. We'll base on the conversation in the review article that I read, and I will put the name of the article in the description box below so that if you're interested, you could certainly search for the article and check it out yourself. Now, the article actually covers studies that look at PRP in non-surgical shoulder conditions, in the management of non-surgical shoulder conditions, as well as surgical conditions. So if you're interested in non-surgical shoulder conditions, you need to go back to the previous episode to check out the video. I'll make sure I link that at the end of this video today. But today we'll focus on the use of PRP, Platelet Rich Plasma, in the surgical management of some common shoulder conditions. So right off the bat, at the time when this review article was written, there was no clinical studies that look at the use of PRP in the surgical management of proximal biceps tendinopathy and also in shoulder labrum repairs. So most of the studies that use PRP in surgical management of shoulder conditions primarily focus on rotator cuff repairs as well as in rotator cuff tendinopathy. Okay, so just a little recap of PRP is. So PRP stands for Platelet Rich Plasma. Basically, it involves drawing blood from you, and the blood sample is being centrifuged into different layers, and it will be then injected together with the growth factors, will be injected into the location of interest. And the biological rationale for this treatment is the growth factors will help to facilitate the healing of the tendon, of the ligaments, and of the muscle. Okay, so like I said, go back to the last episode to check out the use of PRP in non-surgical management of shoulder conditions. So in this review article, it mentioned a study that looked at the use of PRP at the time of rotator cuff repair versus the control group, just rotator cuff repair. And they find that the group that used PRP has significantly less pain, and first thing, it's significant less pain at 3 days, 7 days, 14 days, and 30 days after surgery. They also have improved outcome scores and also an increase in strength and external rotation of the shoulder. So going out this way at, let me check the time, yes, 3 months after surgery. However, there's really no significant difference between the control group and the PRP group in all clinical functional outcomes of the shoulder at 6 months, 12 months, and 24 months after surgery. So then there's also 7 meta-analyses mentioned by this review article that look at basically how patients do at 12 to 31 months after surgery in over 3,000 patients with rotator cuff tear. For those 7 meta-analyses, they actually found no clinical differences between the groups in clinical outcome measures. So again, inconsistent results between studies. The review article also mentions certain study that look at the use of PRP in re-tear after your rotator cuff repair. And one of the study found that only 3% of the PRP group versus 20% of the control group, just rotator cuff repair with no PRP, would have a re-tear. They also found that, structurally, the tendon that's being repaired has more, you could think of it as a structural integrity per your MRI finding a year after the surgery with rotator cuff tear. However, that study mentioned that there's really no difference between the speed of healing of the tendon as well as functional outcome scores between the two groups. So the results were, a few other studies show similar results. There is a decrease in re-tear rates in the group, and also in the cross-sectional kind of integrity of the tendon post-repair, but there's no difference in the speed of healing of the tendon repair as well as in clinical outcomes between groups. Then some other studies look at, okay, how cost effective it is to include the PRP in rotator cuff repair. And they find that unless the PRP costs less than $652.11 at the time this article was published, there's really no cost effectiveness in the use of PRP in surgical repair of rotator cuff. As you guys know, PRP usually is out of pocket, and like I mentioned in the last video, at the time when this article was published, usually PRP would range from $450 to $2,500 out of pocket. So something to bear that in mind. And as far as just rotator cuff tendinopathy surgery, so that would be arthroscopic acromioplasty procedures. It's quite a mouthful. Very similar pattern, you could say, for all these clinical studies. Is some find it helpful, some doesn't. Usually it seems that it helps with pain, but long-term clinical functional outcomes, usually there's no clinical difference. So I think something that I mentioned last time is, one of the possible reasons why there is all these differences or inconsistency in clinical outcomes in the use of PRP in shoulder conditions, whether surgical or non-surgical, is probably because of the lack of standardization in the preparation of PRP, in the dosing of PRP, and even in the administration of PRP. So more studies need to be done on that. But at the same time, there is no adverse effects reported or found in the use of PRP. So it's relatively safe. So it may be something that you and your doctor can discuss if it is a viable option for you. Say you have failed or other treatments, and or if other treatments are not viable options for you. So that's all I have today. I hope you would come back for the next episode of Thought You Should Know. Bye now.